All, this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. So today we had Christy, who was first, I think. Christy was first, DDS second, Jenna third. Jenna, nice to see you. Hope you're doing well. I saw Hammy as well. I hope Hammy feels well soon. He had some health news and was concerned. So, when possible, please pray for him and his recovery. So, hello everyone. Let's get started. So, I see a lot of activity going on around the CDC and the CDC's vaccine document and the masks. So, we will talk about that tomorrow. There is another important thing on this Wednesday. We'll have Dr. Afreen with us. Dr. Afreen has was the one I had discussed his paper in the past about the antihistamines and COVID. So he believes very strongly that histamines and histamine dysregulation is the cause of COVID plus the mast cell activation. So we'll have him with us on this Wednesday. So that would be a pretty cool thing. Okay, so let's start with our questions. So Gold Country says, Sean Hannity has seen the IVM light, talked a lot about it today on radio. I emailed Betsy. Very good. Very good. Good to know. Louis says, does COVID reduction in cytotoxic T cell result from them getting used, or is it a feature of the infection that reduces them? I think it's a part of the infection management that they get hammered. One, secondly, whenever we have overwhelming response that is T helper 2 side, then T helper, each wing, whichever wing becomes active, that wing tries the other side to be a little less active. So generally, if somebody is responding with antibodies, they're going to try to reduce or down regulate the other wing anyways. Plus, there is general lymphocyte number reduction, which is a feature of this infection. Jana says, I have cranial sixth nerve palsy since my surgery. Sorry to hear that. It was over 5 hours anesthesia. My optometrist said he's never seen anything like this. Anyone diplopia? I have not seen this either. Um, was it general anesthesia? Why did? So, are you taking anti-inflammatory? That is an important one. Meaning, was there a nerve getting trapped because of inflammation, or is this a damage to the nerve? Are you recovering? Is there any recovery at all? Sorry to hear this, but sorry, I also have more questions. So Arun says respiratory syncytial virus is also there. Any comments? So they had more viruses that they tried to profile, but the thing is this: when you have a COVID patient, you're not profiling for every virus, and that is why we do not exactly know how many other. So I'll have to see other studies as well, but it is possible that that gets activated too. I just want to have some data to then share. Denise says Dr. Afrin is a mast cell doctor. Yes, and he's great. If Nick Ariza is listening, he had asked me to reach out to Dr. Fung from Canada about diabetes and management of it. Dr. Fung has refused to come on the show. So we did reach out. MSNBC says, are we really sure ivermectin has prophylactic benefit? I am making choices for more than myself, and it is a heavy decision. So again, we just have some studies that show that it does work for the prophylaxis. The question is, if it is a difficult decision, that should be because you are concerned with some side effects. So if you are concerned and if you think there are side effects, then sure. As far as I know, and for my patients and for my family, it doesn't have a sufficient type of severity of side effects taken in therapeutic doses, although the frequency is more than normal therapeutic frequency, even then I've not seen side effects. The side effects that I've seen with this in older patients, I've seen dizziness. That can be dangerous because they can fall, and fall can in some cases be lethal as well if they fall incorrectly, or if they if their head strikes some corner of a table or floor. So in older patients, dizziness can be bad. In higher doses, the visual disturbance can occur. Other side effects have not seen to be that bad, but again, talk with the doctor. So Rima says masks. So my a friend of mine was talking with me about this masks debacle and the CDC, and I was saying that CDC has actually caused so much harm to their own credibility. In the beginning, they said, Fauci said, don't need masks. And at that time, their point of view for saying no masks was people would have a run on masks. They will buy all the masks of the places, and now the healthcare workers won't have the masks, and that is a bad thing. So they decided to say no masks are needed. I showed you the books. I did a video about WHO and CDC and where they dropped the ball, and I showed you the books here that are from 2006 and 2013 and 2016 that said for coronaviruses use masks. So first CDC messed up there to say don't need masks. Then CDC came in and said you must have masks. When I think this was more of a political part. Then a few months ago, when they said no masks are needed if you are vaccinated, they were once again actually taking a political position to say, political or non medical position, and that was let's incentivize people who are not vaccinated to say, hey, look, if you are vaccinated, you don't need to wear a mask. And now they're back to, oh God, we need a mask. So there was a very simple thing to do, and that was from the day one they should have said keep masks, protect yourself and others, use masks, and that's it. They didn't have to do this dance that they did. And now not only they caused damage to people, they also caused confusion, they also lost credibility. If YouTube should censor someone, they should censor CDC news about masks because they are causing damage. But of course, YouTube doesn't care for that. YouTube, Facebooks, others, they only want to cover themselves. So when they say that, hey, we would not like you to talk about ivermectin and COVID, it is not that somehow YouTube knows that it is a bad thing or a good thing. They just know that WHO or CDC has said it. And if ever somebody sues YouTube, they can simply say, well, we were towing the line with WHO. Who else should we follow? So they are just being safe. Michelle says, if virus still here, wear a mask. Why do you need CDC to have common sense? Yes, and for healthcare professionals at least, we know this from 2002, 3, 4, 5 microbiology books that for coronaviruses masks work very well. So then folks in CDC to do this dance and game, which has eventually bitten them back and caused damage to people, that was just bad, unsafe. So HP Sauce says, HP Sauce says, thank you for responding to my tag on the ivermectin subreddit, the post-vaccine recovery case with glutathione. We love your work. Thank you very much. And yes, glutathione is actually a parent or the initial substrate for NSE. So if the NSE is not working, glutathione actually has more functions, including giving rise to NSE or becoming a substrate for NSE's production. So thank you very much. And I saw one more Reddit where somebody there, that was, I think there was a question on Reddit. The question was that chefs, what would you like people to know? What is a secret? Something like that. And in there, somebody had written that I have lost the sense of smell and taste, so it doesn't matter what is good food or bad. And I had written, and there were so many people who were saying we don't have sense of smell and taste. So I put a comment in there that talk with your doctors for ivermectin. I hope so many people were there without sense of flavor. My apologies for the mouse sounds. My tracker pad doesn't work with the. I don't know how to make it work with Windows. Okay, so continuing. Jody says, how will antihistamines alone help long COVID caused by EBV or RSV activation? Won't you also need an antiviral like daily? Yes. Or you know that EBV, as much as um, we say acyclovir can help, but acyclovir has only known to reduce the viral shedding but not provide any clinical benefit to the person. So it is a difficult thing because for EBV there is no good solution. So you're correct that antihistamines are not going to help. However, I had this discussion, the last talk, not before this, but the one last week's last talk, was a possibility of EBV managed by ivermectin because ivermectin helps with the nuclear factor K beta. And we know that for EBV, one of the mechanisms by which EBV disturbs the B cells and immune cells is by disrupting the nuclear factor K beta pathway, or not disrupting, overactivating it. And I had that example, that imagine that you press the doorbell button and then run away. That's the same thing. EBV virus activates the nuclear factor K beta pathway, which is also used by T cell CD40 pathway, which is a message to B cell to say you are holding on to an infected antigen, or to an antigen, not infected antigen. Go ahead and proliferate and become active. So NFK beta is a signal for B cells to proliferate and be active and become immortal as well. And EBV does that, and ivermectin counters it. So that's a very interesting thing. So Gazar says, I still wear masks in supermarkets and local shops, are all not bothered for a small amount of time spent shopping. I wear masks even now. I know that now there will be comments here that you're a sheep and you're a what bad mentality. Masks work, and I know there are going to be comments here that prove it that they work. And the weirdest comment that I have read so far, someone left a comment. Remember, I did a talk about the red blood cells or the blood cells deforming because of COVID, and that may be one possibility of COVID long haul. Somebody left a comment there. You can check it out. It's actually interesting. They said, so you are telling us that the red blood cells are damaged, which means if you wear a mask, you're causing even more oxygen deprivation, I'm paraphrasing, and more damage. So that means there should be no masks. And I was just cracking up at the way, look, masks do not block oxygen, or masks do not trap carbon dioxide over here. The carbon dioxide trapped over here, more carbon dioxide is trapped in the mouth and nose and the whole anatomical dead space. So anybody who thinks that the carbon dioxide is trapped in a mask, please look up anatomical dead space, and you would find out that 150 milliliter of carbon dioxide at all times, not 150 milliliter of carbon dioxide, but 150 milliliter of air has previous breath's carbon dioxide in it trapped at all times. We do a 500 milliliter air inhalation and exhalation at rest, normal healthy adult. And out of that 500, 150 is previous breath air, which is still standing here. So you're talking about mask having some carbon dioxide, which is impossible because mask is exposed to the air. Anyways, this is not even a good discussion to have. Carol Ann, you have a good, cute cat there. Dr. Bean, honestly, you could wear a cat on your head and we'd still love you. Thank you very much. Remember, there was a picture by a patient of Dr. Yo who made a cat on my head. So that was funny. So Madeline says, I'm in Australia. My GP will not prescribe ivermectin. She says she can't, possibly government health policy position. Is there anything similar to ivermectin that I can get, please? So many folks in UK have been, and in Europe and Canada as well, they've been using online um, pharmacies. So can you not do that? And if you cannot do that, I do not know anything that is a good replacement of IVM. So Mr. Sanchez says anything for dizziness, brain fog aside from fluvoxamine. So if you go through the long haul protocol on the FLCCC, steroids, mast cell activation syndrome related therapy, macrophage activation syndrome related therapy are also important to test out. So if you are not getting, um, oh, and one more, NAC, NAC. I think my channel is going to shut down with these things. NSE, my one of my patients, latest patient, she continues to have a relapse. So she takes ivermectin and she takes steroid and fluvoxamine, and then when she does some activities, she relapses. And I asked her to take NAC, and she took NAC normal dose, that is daily, like not some higher doses, normal dose. And she called me and she said, I took NSE 4 hours ago and now I am feeling I'm totally healed. Although she developed symptoms again, but NSE drastically helped her. So Daniel Nick says, in the study you looked at, there was similar treatment with steroids in each group and on yet 70% deaths in the ICU. Do you think steroids may be bad to use in an EBV infection, co-infection? Maybe. It is possible that steroids are suppressing the infection, the cells further, and EBV just keeps proliferating. Exactly possible. Jody says, I think some dizziness is caused by inflammation in air, and that is why the anti-inflammatory steroids and others would help as well. Danielle says, can pregnant women use ivermectin for COVID infection? So I have done this talk many times. Ivermectin is not tested on human pregnant women. On animal studies, it caused damage to the brain of the child. So my position, and this is what is the Goodman Gilman pharmacology book has the same position, and they say because it is not tested on human women, um, human females who are pregnant, they cannot, and it is tested on the animal females whose children developed brain damage, so it is contraindicated. So I believe it is contraindicated. I know that some doctors say it is fine, but I would not take that risk. Now the problem is, here we are talking about a mother and her child and both at risk, so I don't have a good answer, but from a brain damage point of view, it is not indicated. Zan Solo says, what can you tell me about the plant called sumac? There were rumors it being a cure for. No idea, Zan. I'll have to look it up. John B says, if COVID proofreader is so good, why do we still get variants? So, of course, it is not that good. That means we still get the variants. Proofreader does. And there are lots of scientific reasons for how proofreaders either fail or how they ignore some of the changes. Usually what happens is that one amino acid can be made from multiple kind of one base can be made by multiple amino acids, different variations of amino acids. So sometimes those variations can change and proofreader can ignore it. But when if further change can come, it is possible that we end up with a different amino acid and proofreader just doesn't care or it slips by. Timmy says, do you think low dose aspirin combined with curcumin will act synergistically against COVID? So, curcumin is anti inflammatory. It would work in any inflammatory situations. Low dose aspirin has a function in anti clotting, which is also useful. Colin Hamel and Hemi, sorry to hear about your health. Hope you recover fully and soon. Um, so if they test for EBV, can it be missed when it is hiding? No, so when it is hiding, so in general, EBV itself does not hide. The DNA, EBV goes away, the DNA of the EBV sits in the cells. And when it becomes reactivated, then the whole virus is formed. But when it is sitting in the cells, the DNA continues to make some proteins that we can detect. So we can actually detect if the EBV had ever infected a person. So JMT Hero says, thank you for your work. You are very welcome. And hi, France. uh, DC Thomas says, do you vouch for Professor Hector Carvalho? I like Dr. Carvalho. There are certain mechanisms that Dr. Carvalho um, has or thinks about that I disagree with. For example, he feels that ivermectin should not be taken near vaccines, and I don't feel that that is uh, an important mechanism. There is no such mechanism that would disrupt. So, other than that, I like his work. Radh E says, I have ulcerative colitis. What are the risks of taking aspirin beyond bleeding? So, this is something that you should talk with your doctor. The doctor would know your history and they would know what is your tolerance. They would be able to have your history in their mind, other patients' history in their mind, and kind of think about it. So, you have to be careful, of course, because aspirin can cause issues, but exactly how much is a possibility? This is what your doctor should look at. France did we thank you, France. Uh, Mary Jean says, any indication that hepatitis can be reactivated by C19 infection like EBV? Is there any mechanism by which the vax could reactivate viruses? Thank you. You're a gift to humanity. So thank you very much. And no, not that I have seen any study about the hepatitis. Having said that, many viruses and fungi, they bounce up when a person's immune system is busy and weak. So there is opportunistic pathogens that we already know will pop up in weak times. But here are the reactivations which are also occurring. And for hepatitis, I've not seen any study yet. Genesis Light says, in Indonesia, the government is distributing cocktail of treatment that includes oseltamivir, Tamiflu. What could be the mechanism for this to be effective? That is interesting. Why Tamiflu for COVID? No idea. They're thinking maybe it would act as an antiviral for it. I'll have to look it up. Good question. Daniel, are they basing this on some study or just hey, give this antiviral? What would be best protocol for pregnant women for COVID? Very difficult question. Um, don't know. This is an area which I am just so less knowledgeable and expert, and I'm so sensitive about this area that it is a ironic thing that I spoke about pregnancy once a few weeks ago, and that was an incorrect position of a researcher. And I, the next day on my off day, I had to take down the previous one and redo another discussion and say, hey, I'm sorry, I misspoke, and here is the correct position. Although those researchers then reached out to me afterwards and saying, um, you were, they wanted to talk with me, and they were busy, then I was busy. So Augie says, love your show. Thank you very much, Augie. Um, ET says, any updated thoughts on baby shampoo, nasal rinse, or nasal sprays like Xlear, um, etc., that is supposed to be. So we have done this discussion that there are possibility of keeping the nasopharyngeal area clean reduces the viral load. So we did a study discussion, we meaning all of us together, about the mouth washes and nasal sprays. So there is a benefit. How much is the benefit? There is only one study. Dr. SB says, do you think spike protein in deactivated coronavirus vaccine being deactivated? Okay, so inactivated coronavirus vaccine being in the already unlocked form is the reason why such vaccines have less efficacy than expected? Maybe, or maybe the inactivation caused damage to the pathogen, or maybe the antibodies did not form well. I don't know. Maybe their adjuvants are not enough triggering to the immune system to bother the immune system enough. So once they show the data, only then we can see it. But there could be many reasons. In theory, a inactivated virus vaccine should work better than just a spike protein. Genesis Light says, if you donate blood, would you lose some of your floating around antibody natural vaccine? Yes, sure, in that amount. But we have a lot more blood, number one, and we continue to produce a lot more antibodies. So, yes, you will, but that is going to be negligible. In terms of if you're trying to lose them, that is negligible. If you're afraid that you would lose them, that is also negligible. Jack says, an honest doctor is more valuable than gold. Thank you, sir. You're very welcome. Um, so Nick says that Tamiflu uses neuraminidase, a protein on the flu, as a target. So that really doesn't make much sense unless there is possible flu outbreak leading to more severe infected. That's correct. Yeah. So that means it is more specific to the flu virus. MMSNBC says, if unvaxxed and vaxxed can create mutations when they have the virus and share, how will we ever get out of this? Um, so the good news is this, the mutation so far. Let me draw this part. So the short answer is we'll get out. The a little more drawn answer is the following. So we are so SARS-CoV-2. I don't like this. And do you see the pen's stroke? It's light in the beginning, and that it makes these weird alphabets. Anyways, so SARS-CoV-2 is about 14% different from SARS-CoV-1, correct? So this is one, this is two, or MERS-CoV. This 14% was sufficient for us to feel that this SARS-CoV-2 is altogether a new virus and become ill to it. We have other coronaviruses as well, human coronaviruses, human coronaviruses, and we respond less with less severity if we have the human coronavirus, but still we do become sick. That means a coronavirus's infection may not 100% prevent another one if the mutation is large enough. That means the difference in the variants is large enough. Now, the mutations that have occurred so far on the SARS-CoV-2, what are these mutations? So let's say SARS-CoV-2 is 29,000 base pair, 29 kbps, right? 29,000 base pairs. For those 29,000, out of them, um, how many amino acids have changed? So one amino acid is coded with three base pairs. So let's say if this was 30,000, that would mean about 10,000 amino acids. Now, 10,000 amino acid, and there are, what are the mutations you're seeing? 17, 20, 21 amino acids. Now, what is this percentage? 2100 divided by 10,000. Alexa, what is 2100 divided by 10,000?
2,100 divided by 10,000 is 0.21.
0.21%. This is the change so far. We know that if the change goes to 14%, maybe it is 10%, but we know the viruses that are 14% different. Maybe it is 5%, we don't know that. But we know that if the change goes to 14% ish, that is when this virus may give rise to SARS-CoV-3. So far, the change that we are seeing is even below 1%. So for this virus, these changes to end up causing a altogether new strain, which would then go even in the infected and uninfected everyone, is going to be difficult. So then, of course, the question will become, and this is why I wanted to address it tomorrow. The question then will become that, hey, we have just the CDC's internal document that is saying that we have so many breakthrough infections and we need to change our messaging, and the war has changed. And I think that I looked at some of the data. I haven't looked at the whole document because I have not found it. But some folks have put some slides up, which I don't know if they are really from there or not. But that data has not been saying anything that I have been talking about, that a person who is vaccinated can get the infection. And the important thing is that they would, so let me draw this part as well. This is not going to be new for the cool beans here. And that is a person here. So let's say this is a person who is vaccinated. There is nothing to stop the virus from landing in their mouth. The mouth is at the wrong place. Here, mouth, landing in their mouth. Correct? Now, once the virus has landed in the mouth, then the question is how fast will their immune system respond? And we know that for a B cell, which is sleeping, for this B cell and T cells as well to become fully activated, it takes anywhere from 10 hours to 48 hours. To me, it seems like the folks who wrote that presentation probably did not know this. And I think I've lost enough trust in CDC that I can actually believe that now they might have people who do not know this. If before the pandemic somebody had asked me this question and somebody had made this comment that CDC actually is made up of competent people, I would have said yes. And if somebody said they are made up of some incompetent people, I would have said no. But now I think majority are incompetent and some may be competent. So here, the 10 to 48 hours, I'm sure that CDC is now going to come in and, unlike this video plus report it as well. Oh well. So 10 hours to 48 hours is when uh, the immune system, the B cell, will realize that there is a virus again and then increase in number and start making antibodies. So it would take some time. Now, in that time, during this interval of time, when immune system is ramping up, the the virus is causing destruction in this person. Now, because Delta virus causes destruction fast, that means within this given period of time, 10 to 14 hours, there may be more destruction, even to the point for some vulnerable folks that they die. It causes so much of the tissue destruction. That doesn't mean really that it has escaped the immune system, because once the immune system comes in, it would take care of the virus. But it has escaped the immune system in another way, and that is it did the damage before the cops could arrive, and it ran away. And now the it didn't run away, but I'm just making it up. It caused enough damage before the cops arrived that there is a lot of bloodshed in the tissue. This is what's happening. And so, as more and more people will be vaccinated, you'll see more and more of these infections in vaccinated as well. The question is, what is the percentage that is becoming sick? So, going back to your question, what was the question? Yes, so vaccinated and unvaccinated. I don't think it is, again, the good science has become muddied up by vaccinated folks asking the unvaccinated that you guys are causing a problem, and unvaccinated folks causing asking the vaccinated folks that you guys are causing a problem. I think we should have been beyond that. At the same time, there is a good news today: 70% of the US adults have become vaccinated. Today we have reached that milestone. So again, because the virus has become faster, the R naught has increased, and so 70% is not sufficient, but still it is useful, because those 70% plus those who have become infected and recovered, plus those who are asymptomatically recovered, they're all part of the protected community. So this is a good question. Gibraltar says, have you seen frequent urination in your patients? Urination also seems to become more frequent after going for jogging. I've been experiencing this 6 months after alpha variant infection. It is possible that there is either an overactivity of the bladder or sympathetic system, and parasympathetic system imbalance occurs. So that causes tachycardia as well. It could be cardiovascular system dysregulation, which causes vasoactivity that causes kidney to feel that there is a higher blood pressure, and it tries to then do uh, create more urine to reduce the blood pressure. There could be direct damage to the kidney as well. So I do not know exactly what is the reason. I haven't seen this complaint in my patients, but there are possible mechanisms. Jen says, rapid antibody tests, how do they work? Are they like a pregnancy? I had actually done this discussion in the past as well. Yes, they work just like pregnancy, correct. Uh, if the antibodies are present or not. That's all. It's say positive or negative. They cannot tell you exactly how many antibodies or level, but they can just tell you if you have antibodies or not, correct. Eric Arnold says, thanks for all you do. Any studies you point to, or if not, the most recent data you're aware of, on efficacy of flufenacin in prophylaxis against Delta variant specifically? Not that I know of the Delta variant itself. That's a very, very interesting question. So thank you for the super chat, but this is something I need to look into. Very good question. I actually didn't think about it. Sean Diamond says, what have you heard about Lambda variant and vaccine resistance? So I did a video 2 weeks ago. The title is all about Lambda variant. Please watch it. Not much concern yet. So DIY Grandma Farmer says, do you think using an ultraviolet light situated near the entry door optimally to kill pathogen on packages, items entering the home is helpful? It is, as long as you don't end up, and you have already said placed optimally, as long as it is not the kind that might burn humans and their skin. But yes, it can be useful. So France says, yes, Jody, great question from Raj. What is that question? I want to see that too. Um, where is Raj's question? Oh, Caroline. Caroline, Raj is your cat, right? Bengal. So did Carol? So let's see here. Raj's mom. Okay, so I reached there. As the virus mutates, can the human immune system also adapt to anticipate the next variant? Um, Actually, we already know how to handle the next variant. That is why we are handling SARS-CoV-2. So very good question. And actually, I wanted, I think this is the kind of a question I answered once before. It is a very, very interesting question. So here is what happens. Imagine this is a structure, some structure, and it is a dangerous structure. Our body does not want, let's say this is a virus or this is a bacteria, something bad. And then there is something else that is bad as well. And then there is something else that is bad as well. And so our body has to figure out a way to manage majority of the pathogens, even those that have never entered our body, just like SARS-CoV-2. So the question is, how do we do that? And the interesting thing that body has learned to do is to say, you know what? Instead of the whole pathogen and trying to recognize that, I am going to learn to recognize tiny patterns on pathogens that the body, has seen to be repeating almost on all pathogens. This is just like this, that if I write a statement, so let's say um, we are cool beans studying together, having, I'm sorry, having fun. So I want to write a little bit and more. Good. So I've written some statements. So let's see now, if I have to have my immune system recognize this whole string to attack it, then tomorrow, if there is a tiny bit of a change in it, then my attacking system will not be able to attack that. So my body has learned, and all of our bodies have learned to do this. What they've learned to do is, for example, let's say, um, learned to figure out some patterns that are repeating. So is there a pattern that is repeating here? So look at this one, ER here, and this RE. For the immune system, one way or the other doesn't matter. They both are repeating. There's another RE that is repeating. And if I had written having fun, and so let's say similarly, if immune system had also learned to attack ant, this is going to be very common in many of the writings, or some other patterns, we, or let's say cool, and so on. So instead of the whole big pathogen, or let's say a full building, immune system has learned to attack a combination of 5 or 6 bricks. And it turns out that majority of the pathogens and antigens do have those patterns in them. So let's say if there is a pathogen, let's say a bacteria or SARS-CoV-2, and now we just said that SARS-CoV-2 has 10,000 amino acids, right? That means these amino acids are lined up and they are making a pattern. There is going to be guaranteed parts of the shape here that will become recognized by our immune system. So that means if we make SARS-CoV-3, will our immune system recognize that immediately? Yes. SARS-CoV-2, were we able to recognize it immediately? Yes. So then your question should be, if we were able to recognize it immediately, why did we not respond? It is the response that takes time when we recognize something the first time. So our immune system actually looks at SARS-CoV-2 and the patterns on the SARS-CoV-2 and actually figures out that, oh man, this is something that is really not a good thing. But still, the whole immune system to respond and become active takes 7 to 15 days, especially the adaptive arm. Innate arm start working right away. Now, when the same thing, once we make memory, then the only difference is that memory cell can recognize the same pattern and become active right away. Their gene structures are already reprogrammed, that they know as soon as they see this how to quickly become active. This is like this. Um, there was a time I used to travel a lot to go to before pandemic. Various universities would call me to come and talk there, or various organizations would invite me to come and talk about diabetes or hypertension or other things. So I used to travel. And when I started traveling many years ago, I used to panic because I did not have my clothes in order and the the suitcase properly, organized and everything. So it would become a panic. And then I learned that okay, for my travel, I need following things, and they should be structured this way, and they should be already present this way, and I already have a traveling system ready. So if somebody calls me to say, hey, in 2 days, can you come here and deliver a talk? I know I'm going to pick up my traveling suitcase and I'll go. Now I'm ready. Was I not able to become ready before? Yes. Did I not understand that I need to travel? Yes. But I needed some more preparation. That is the same thing. Our immune system actually knows how to kill this virus, but it takes some time to become ready with all the poison and potions and antibodies. But once it becomes ready, then it stores those reprogrammed cells for the future. So it doesn't have to spend 2 weeks in the future. Now, to go back to your question, if you said, hey, this is going to become SARS-CoV-3, here is the SARS-CoV-3, right? So quite a serious looking dude. And there is SARS-CoV-2, 3. Will we be able to work against that? Yes. But it is possible that if it is, let's say, 14% difference or 20% different, then it is possible it is also a new pathogen for us, and we would have to once again detect it and take 7-10 days to attack it and kill it, and that may not be sufficient. Or if the SARS-CoV-3 has become weak enough, then it might be that even if it is, we're going to wait for 7-10 days, during that time it's not causing a lot of damage, although we are seeing that it is becoming faster. So very good question. And the basic idea is that our immune system doesn't need to anticipate. It already can recognize majority, almost all, of the antigen patterns. It just, once it sees a new pattern, it recognizes it. But even then, it needs time to reprogram its cells to respond, the um, adaptive arm cells. That is why it has learned to keep them as memory cells, so it doesn't have to spend that time reprogramming. Beautiful question. I loved it. I hope I answered it in the same beautiful way, the way this question was beautiful. I am sure that that was because of Raj. Whoever has Bengal cats, they have beautiful statements to make. Sandy says Dr. Bean should be the head of CDC. Thank you very much. Um, Dr. SB says, what do you say to the American public losing faith in the vaccines, maybe even feeling misled due to the breakthrough infections when it was clear the vaccines are not 100% effective, anyways? That is, look, it is not vaccines. It is so funny. I have been looking at these communications. my hands were tied to respond because I was going through this Epstein-Barr virus series. But I was looking at the Twitter threads going on and people talking about it, and I was talking with my wife, and I was saying there are two issues that are going on right now. Number one, CDC decided to take care of political positions, and unfortunately, they're a bureaucratic system. If they are going to take political positions, they will have to take positions with whoever is in politics. And now, if the previous government versus this government, they're going to be their politics is different, then now CDC has to change their politics. So they departed from scientific approach and became political, and now they are running around because wherever the politicians are pointing, that is where they're going. That not only took their credibility away, that made them make wrong decisions like masks. I have been making fun of CDC. Apologies to the CDC folks. I've been making fun of CDC's decisioning around masks for a year because they just keep making bad decisions. Similarly, now the decisions on the vaccine. Who, you tell me this, you like a vaccine or not, but if you were told in the beginning that, hey, this is a respiratory things vaccine, it's not going to be able to fully protect us. Vaccine, even after the vaccination, we still would end up with the infection. And to the doctors, I'm going to now draw to explain it. Imagine this is CDC talking with the doctor. They'll have to have two communication channels. Imagine they started that a year ago, and they said to the doctors, hey guys, if a vaccine is taken here, fully vaccination, so let's say second dose, 2 week after the second dose is here, from here to some months there would still be immunoglobulins, and then these immunoglobulins would go down. During the time that immunoglobulins are there, we would suspect a higher quality of protection, because during this time immunoglobulins are there and they are present. IgA is present here as well, so mucous membranes are protected too. So for 2-3 months a person has a chance of enjoying best protection. 2-3 months later, the immune cells will go to sleep, and when they will go to sleep and the virus would arrive, they would take some time to wake up again. During this time, I should have made this red thing green. During this time, the person would experience symptoms. And if something like Delta, if the virus has become faster, which they probably couldn't anticipate, but let's say if the virus was more deadly, not deadly, more virulent or contagious here, then hey, there may be some patients who would even die here, who will become severe here, who would have hospitalizations here. And so please, not only you should know this, you should tell your patients as well. This is one part of the communication going to the healthcare people. I never received any such communication from CDC. Uh, but again, I'm not working in the US, so maybe US folks did. I doubt it. Now, for the general public, they would have said, we are giving you vaccines. These vaccines are going to reduce hospitalization's chance by, let's say, we think 70%. And they would reduce death rate in vulnerable by, let's say, 90%. However, there is still going to be people hospitalized, there are still going to be people infected, and even those who are running around, walking around, are vaccinated will get infected, because the virus is still going to end up in their mouth. And if it's immune system is still waking up. During that time, the virus is replicating, and if you do a PCR, you're going to see a positive result, and that is okay. Don't worry about it. And so, if they had given this communication, you tell me this, will people not, they like a vaccine or not, will they not have a better trust on CDC? At this time, CDC seems to be deceiving by their messaging. I'm sure that it's not their actually plan to deceive people, but the way they're making dumb decisions, they are looking incorrect, and they are actually doing these things. So, to your question, yes, they have, and I had been saying this for about a year ago, that CDC's communication should be better. They should have stalls on the roads, and they should be giving pamphlets out and telling people. So if somebody came to them, to their stall, and said, hey, I heard that vitamin D is great, they should say, you know what, we have also seen the studies that say that vitamin D levels should be correct, and that helps with the protection. That's not a replacement for the vaccine, but yeah, please make sure that your vitamin D levels are correct. We can help you test with this kit right here, and we can give you vitamin D right now, and please go talk with your doctor too. They would have spent less money and provided better, trustable, reliable, and information which majority of the Americans would have loved, and they would have bonded with us more. Instead, they said this guy called science, and that science guy just went everywhere where and just said things. And now it, so again, you don't know my politics, and I don't want to add my politics to this. So you don't know if I like one president over the other. But this science guy afterwards said, well, I was under pressure to say one thing or the other. Well, then you should have resigned if you were not doing your job. And now, once again, masks messaging is all over the place. So, is there pressure again, which is going to say after some years to say I was under pressure? So, it's just weird. Sorry for the rant, but you asked a question that was like, that needed a rant. Okay, so Jimmy, are you familiar with doctors Andrew Kaufman and Thomas Cohen's analysis of the issue of virus isolation? If so, please share your thoughts. No, I'm not. Uh, Nick says, I think the whole as lies versus not information pipeline from the CDC was harmful for masks. They gave no overhead explanation of actual mask mechanism, viral load or drop. Absolutely. And tell me this, what is their function during a pandemic other than talking with us? Why did we have to hear Fauci? Why was there not a communication department from CDC? Why did they not have uh, their stalls and their communication systems pop up everywhere? We are stuck in this thing for 16 months now, and we have spent billions and trillions of dollars, and we have incurred losses of trillions of dollars making these small stalls. Was it difficult? They could have made small cars which had, let's say, they could have made those vehicles like these, and exactly like this cartoonish vehicle. And over here, they would have said, COVID, and there is a loudspeaker here or something. And they would put that somewhere and say, please ask your COVID questions from us. We're sitting here. We are CDC. We are your servant. We are serving you. Come and talk with us. And that thing could have been moving around and educating if they could put a stall everywhere. There were so many ways to get ahead of this communication gap that they created. And taking this position that, hey, politicians had pressure, then stop doing it. Just don't do your job and say, I can't. Loving Life said, don't you think the government allowed the infection to spread intentionally? Fauci told us not to wear masks. No, I think they made bad decisions. You can convert it into this, that Fauci said no mask in the beginning. And the reason was not that he did not know. I think so. that the masks work. I think that his reasoning was that masks were less in number and healthcare workers needed them, so he just said to the population that he don't need masks. What is that BS? There are people who would die if we take that kind of position. Instead, the position should have been, we don't have enough masks right now. We're going to try to give prioritize the mask for the healthcare workers, and you would appreciate it because they are exposing themselves to a deadly virus. We would request you to make your own masks or stay at home if you don't have a mask yet. We are working to get you more masks, and we'll give you an update next week or tomorrow, and we'll tell you how many more masks are there. And meanwhile, please don't panic. Please don't worry. We are working on it. Soon we'll be ahead of it. What was bad about this communication? So, yes, so loving lies, it looks like it then that they knew it and they missed the ball on it, and that means they caused a damage. But I don't think that they meant to cause a damage. I just think they made politically influenced decisions, which now they are getting the taste of it, that politics could be anything at any time. And now they're having to make decisions which are different from the previous ones, and the same people are now making opposing decisions. So let's DDS upload says the FSCCC prevention protocol recommends a nasopharyngeal sanitation with betadine iodine spray 2 to 3 times a day. Would this be okay for someone who takes synthroid for hypothyroidism? So synthroid and hypothyroidism, ideally this should not have any issues, but please talk with your doctor as well, because I cannot give an advice. Cassandra says, then they will never ever admit they were wrong. They will not. Look, I wish that they would come out and even now say that we were wrong. But the problem is, saying we were wrong is to admit that there may have been so many people dead because they were wrong. Then there needs to be an accountability. And there is not going to be an accountability. So that means there's only going to be just, can we sweep it under the rug? And this is why, for them, it actually works out when people are fighting with each other. Hi there says, would lufimectin taken weekly prophylactically in a vaccinated person help keep them safe from all COVID variants? Ideally, yes. So the studies that have been seen, they have 74% efficacy prophylaxis. So there still is a chance, but the efficacy is good. Denise, yeah, absolutely. If they come out today and say, you know what, sorry, we were wrong, that means all of a sudden people are going to say there are these 600, 700,000 people dead, and so many people damaged for a very long time, some even permanently for their lungs, and so much misery that occurred. Who is going to answer for that? So I don't expect any accountability taken by anyone. So, Vicky, I had actually said about the first quarter of the this year. I had said that in another couple of months we should be done with the um, with this. So that meant fifth month at most, May. But now we are in June, July, and August. Um, how is the? Let's see if I can go here and see how is US doing. So my apologies if I don't operate on this thing correctly. So let's say worldometer coronavirus US. It used to be so much fun with Mac. I would just do a pinch and zoom and increase the size and reduce the size. I think I have to press control and then do this. Yeah, something like that. Okay, so I tried to press spacebar. All right, so here our cases are increasing. So we have reached, for example, 98,000, 100,000 I just saw. Let's see if the number of deaths have decoupled. So number of deaths have only increased tiny bit, which is a good thing. I don't want to sit here and wait for deaths to increase. And that is the decoupling that we needed. So if you look at these numbers, all that um, crazy set of noise, this is correct that deaths would follow after some time. But please also realize that delta has become faster. So the number of deaths would also follow quicker. And we are not seeing that, which is a good thing. So, Vicky, from this graph's point of view, we are at the end. I hope that these goes away as well. But this has been, so when was this lower level of death? So let's say 430. Let's do 7 days moving average. So we are at 341. Did we ever have that kind of a number earlier? No, other than in the beginning. So 341 is March 28. So we are at that level. I think we are almost out of it. The politicians have to decide to stop politicizing this and decide how to open the country. As much as sometimes I don't like Britain for certain things, but still, if you see, they had plans to say Britain would open back up this way, and on this date we'll do this, and then we'll for vaccine. Here is our plan. Here is our reasoning. At least from here, it seems structured. US does not seem structured that way. So I just wish that we had a planful approach to it. Jimmy says, Dr. Bean, how do you know viruses exist? How do you know what we are calling viruses are not really just exosomes? Um, no comment. Good question. Gold Country says, gotta go. Good night. Are we that late? 7:45. Leonard says, are you familiar with Merck getting a grant to make a new drug with some? Yeah, so there is an article about the molnupiravir which has my statement that, hey man, they're just using these mechanisms. And yes, they have $1.2 billion order already on the table for them. And now Pfizer is coming up with a drug as well. So all of these companies are saying, oh man, we have one more way to earn now. We can make a drug as well. So that's happening too. So Rai says, friendly opinion, no medical advice. If a double vaccinated person is traveling to a COVID hotspot, what would be a good lufimectin protocol? So if I am traveling, I would take lufimectin daily till I'm there for 3 4 days. And I'm comfortable that I understand the environment and I know who to go near and who not to go near and who is sick and who is not sick. And then I'll decide to go to weekly. But meanwhile, I'll take it daily. That's what I have done actually. When I started getting exposed, when they said that, hey, don't take mask, I got exposed and I was just taking it daily. So, antiviral spray in Israel, I'm not sure, but I'm sure that it had some properties. I didn't hear more about it. So, Marlo says, do Delta appear to be more deadly? No, it appears to be more contagious, but not more deadly so far from the data I've seen. Danielle says, do vaccines protect from long haul syndrome if you get a breakthrough infection? I have heard from some long haul patients that taking one dose has helped. Some long haul patients have said that taking second or third dose, there is a long haul patient who Dr. Yo tweeted about. Somehow they felt better with one dose. So they went and took second and third dose and they had a severe relapse. So I've heard one dose in some people have helped. Vinod says, does antibody response after first dose vaccination predispose immune system away from killer T cell and K cell response pathway, hence increasing chance of vulnerability? Not at all. No, it is not even possible. Meaning that we know there is no mechanism that does this. Lokesh Tiwari says, long time no see. Yes, we've been here. How are you doing? Doing good. Please explain R count. What does it mean when it is greater than one? University of Michigan saying India's R count is greater than one. Should we be worried? So R count is this. So let me oh man, what did I do? It is so funny to use Windows after using Mac for so many years. Okay, so check this out. Um, let's say we have a society. I'm going to make up an example off the top of my head, so it may not be the best, but I will try. So let's say there are 8 people, and we want that one person needs to be protected and will not take a vaccine. That means everybody else around that person should be vaccinated. The so let's stop that for a second. R naught of a pathogen is that from one person who is infected. So let's stop this for a second. Forget about this one. So let's say this is a person who got infected. From that one person, how many people are becoming infected is the R naught. So, for example, in case of SARS-CoV-2, the Wuhan variant or strain, or not strain, variant, had an R naught of 2.5 to 3, but it depends upon the society as well. Some societies have less protection because of their socioeconomic status, or because of their population status, or because of their geography, or because of their habits, and so on. So, R naught of the same virus can be different in different settings, but R naught is one person transmitting it to others. How many? When the R naught reaches to 1, we call this to be a stable disease. What does that mean? Is that disease is not increasing. One person is not making 2 people sick. One person will make only one more person sick. Then this person who made the other one sick, this person will recover, other one is sick. Then that other one is going to make one more person sick and then himself become recovered. And so we say that disease is in a stable state. If R naught is lesser than 1, then we would say that disease is now finishing in the society. When R naught is greater than 1, then we say that one person is making 2 sick, then these 2 are going to make 4 more people sick, and so disease is spreading. So when somebody says that hey, R naught is greater than 1, all they're saying is disease is spreading, which we know already. And the Delta variant is spreading faster, so its R naught is higher. I was going to then provide I started with the herd immunity. Herd immunity's mathematical definition is that equals R naught minus 1 divided by R naught. So if let's say the R naught was, let's say 3, 3 minus 1 divided by 3. So one person was making another 3 people sick. It was R naught was 3. So 3 minus 1 by 3, 2/3. So if the 2/3 people have become protected, they have reached herd immunity. Now, if the R naught, this chicken pox thing, chicken pox's R naught was high. So what they were doing was they were saying R naught is high. You can actually see that that internal CDC document was written by some internal fear mongers who wanted to alert others to say, come on, guys, wake up. we see an issue. And it is possible that you looked at that data and said, no, no, your concerns are not valid. But, anyways, let's say R naught is 6. That means one person, the virus is spreading so rapidly and it is so contagious that one person is making 6 people sick. Then the herd immunity will be 6 minus 1 divided by 6, or 5 sixths. So out of every 6 people, 5 people need to be, what is that, protected by vaccine or by a natural infection and so on. So that is the um, discussion location. Welcome. Gary Eubanks says, can you have a future discussion astaxanthin's possible role to reduce cytokine storm of outpatient who do not have access to steroids? Hmm, I can do that. Okay. Can you please remind me again? My notebook is not working here because I don't have a notebook here, and I need to figure out which. I think OneNote or something to use here on Windows. So I'm not going to be able to take a note today. So please remind me once more, or just tweet that at me. Cool. So Nick says, what do you personally think is the way that we should effectively treat COVID 19? Vaccines, lockdown, mask, vitamin D, ivermectin, alternate treatments. So, I have always talked about it in this way that number one, our immune system should be as balanced as possible. I don't believe in boosted immune system, but balanced. Boosted immune system would react more, and that can cause more damage. So, balanced would mean correct nutritional status, good control of diabetes, less stress on the system, on our body, and then vitamin D's and E's and C's all correct, or vitamin D a little bit on the upper side, 39 instead of 29. So that is one. Secondly, um, if possible, then of course, lufimectin weekly, 0.2 milligram per kilogram, if possible, if one can take it. Quercetin and zinc are very important because they can help as well. Then masks. I am a pro mask person. So mask. Um, Lockdown in the hotspots, but not everywhere. I don't think that lockdown is needed everywhere, but lockdown should be for the hotspots. And of course, vaccine. I am a pro vaccine person for the whole year. Some people say to me that somehow because YouTube would take your videos down, that is why you have become pro vaccine. No, I was always pro vaccine. I am the one who also talks about vaccine side effects and how to manage them. But I am a pro vaccine person. So I think these are the ways I would handle it. With, I think a lot of stress would have been reduced if the communication was good. So people knew exactly what they're facing and how to manage. That would have reduced some stress. Now think about this CDC thing. Yes, folks who don't like the vaccines, they picked it up and they used it, but did this not create anxiety in everyone? Did this not make it look like something is hidden there, something they're not telling us? That anxiety is unnecessary, and good communication should have been um, there. So Nairi says, talk about the booster. So that is the same thing. For example, today I was just reading that they're saying, well, fine, now we would need quarterly boosters. And really, the vaccine companies would happily go for boosters. That gives them more money. They would love it if we say vaccines have failed and now we need to give boosters. So I don't think if we have reached the point of boosters, but they jumped on this kind of thing to start talking about boosters. DIY says, look like, sorry, I didn't catch this question. London Back says, what is your opinion on the spike protein and the endothelial cells? So I did this discussion last week. That is um, so this much is not a good question. Spike protein and endothelial cell, Question is on live endothelial cells in the body or on the petri dish. If we talk about in vitro setting, then spike protein can cause damage. In vivo, spike protein would not have a chance to connect with the endothelial cell and cause damage. So really it depends what is the setting. All right, so good. I think enough time for today. We'll continue with our discussion tomorrow. And please remember, day after tomorrow, we'll have Dr. Afrin with us as well. And he would be with us morning 9 a.m. So, with this, thank you very much. Please like, subscribe, and share if you like this work. And if you'd like this work and you want to support it, you can support it too. There are 3 links. One is for the PayPal, the other one is for Patreon, and another one is to buy me a coffee. So, thank you very much, and I'll see you tomorrow.